I am Dr. Sebastien Lalonde. I'm a hand and microvascular surgeon at MU Healthcare. Anything that's wrong with your hand, anything that's wrong with your wrist, whether it's from wear and tear, whether it's trauma, whether it's something you acquired or something that you were born with, we're here to help you, and that is what I specialize in. So I went into medicine to help people. I've always been fascinated in human physiology and anatomy. We're really the masters of everything that has to do with the hand. So it incorporates parts of orthopedics, where we take care of bones, plastic surgery, where we take care of skin and soft tissue defects, vascular surgery, where we deal with small blood vessels. That's part of what makes it so interesting, is you can have a day where you're doing a lot of arthritis surgery and days where you spend a lot of time under the microscope. Here at MU Healthcare, we have the Limb Preservation Service, where we're helping people that have complex soft tissue issues. It could be related to injury, it could be after having had tumor surgery. We're responsible for helping reconstruct limbs where soft tissue is missing, and that could be anywhere from small surgeries involving skin grafts to very complex surgeries where we're harvesting tissue from other areas in the body where you don't need them to cover areas where you need it the most. We really like to be patient-centered. I think that the way you treat somebody's hand, if they're a piano player versus an elite soccer player, will be different. Outside of work, I am a very musically oriented person, played instruments in my childhood, instruments that are a little less common like the accordion and the saxophone. Music is very much a part of my life. So another passion of mine is cooking and baking. One of my specialties is making my own Montreal style bagels from scratch with the dough, the boiling, the baking, and I can safely say that I make the best Montreal bagels in all of Midwest. Very importantly in orthopedics, I think having patients' goals in mind is what's the most important, and it's establishing that trust.